What are onlays? Dental inlays are restorations cemented to the tooth to rebuild lost dental structure. They are performed on posterior teeth with mild to moderate cavities, or those that have suffered cracks or fractures. Dental incrustations? Could you explain it to us? Although in the past, inlays used to be made of an amalgam, nowadays the most common are made of porcelain or a composite resin. Depending upon the surface of the tooth to be covered, we can differentiate between different types of inlays. Inlay does not cover any dental cusp. It is used to restore extensive cavities located in the middle area of the molars, both lower and upper. Onlay covers at least one cusp but does not cover all of them and the middle part of the tooth. Overlay differs from the onlay in that it covers all of the tooth cusp. I would like to know a little more about onlays. Onlays are used to treat extensive caries involving one or more cusps of premolars or molars. Can be compared to a dental crown, except that an onlays replaces less healthy teeth, making them a more conservative treatment option. In what conditions are onlays indicated? Onlays are used to treat extensive caries involving one or more cusps of premolars or molars. Can be compared to a dental crown, except that an onlays replaces less healthy teeth, making them a more conservative treatment option. In what conditions are onlays indicated? Onlays are indicated for large cavities that require a coating of the cusps, such as teeth that have undergone endodontic treatment. What is the procedure to place an onlay? The procedure to place an onlay usually requires 2 dental appointments. During the first appointment, the tooth is carved. That is, the dentist will remove the decayed or affected part to prepare for incrustation. Later, they will take an impression of the tooth to send to a laboratory to create the permanent restoration. Finally, the tooth is protected until the next appointment with a temporary inlay. At the second appointment, the dentist will remove the temporary inlay, clean the cavity, place the restoration, and ensure good cementation. After reviewing the bite, he will proceed to polish the inlay to match the adjacent natural teeth. Thank you very much for what you have explained. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental, as well as our Facebook page. We look forward to your visit, and we will make a timely diagnosis. Our dentists in Oxnard, St. Paul Adventure, Newbury Park, and Port Hueneme will be able to guide you towards the best treatment to take care of your health and give you back your best smile.